There's a lot of assumption that aesthetic plastic surgery is predominantly for the females, but you'll be surprised that male aesthetic surgery is on the rise, and increasingly we are seeing, according to the statistics, the number of males seeking aesthetic surgery is constantly on the rise, and year on year it's improving by almost 15 to 20%. And the most commonly performed aesthetic surgery procedures, you can categorize them into two categories: the non-surgical and the surgical. So let's talk about the surgical categories where males come forward to get their surgeries done. So if you take the hair transplant, that's the most commonly performed surgery. Taking away hair transplant, a lot of males also opt for mustache reconstruction, beard reconstruction, which is again very popular. And so by and large, hair transplant is the most commonly performed procedure. Now, following hair transplant, you have gynecomastia. So gynecomastia is a big time surgery for males, especially the young males in their 20s. They do not want the man boobs or the female looking breast. They want a flat looking chest, and obviously it's a very popular surgery. Now, post-COVID, we have seen a lot of males who are getting very conscious. They want their abdomen very sculpted, and they've done everything to keep themselves chiseled, to keep themselves thin. But despite doing all that, they're not able to maintain or not able to get the six packs. So this is where plastic surgeons, we come into the picture, and we select our patients well, and we try to etch the abdomen wherever there is a muscular definition required. We give them muscle definitions and we give them all the cuts. So six-pack surgery is again very frequently done procedure on males in our country. Now, after the six packs, then it's again the liposuction, which is again a very popular procedure for our male patients, especially the abdomen, the flanks, and the lower back. The other important surgery, which is again popular, is bariatric surgery. Post bariatric surgery, a lot of these males, they lose a lot of weight. So obviously there's a lot of sagging in the chest, in the abdomen, in the thighs. So we do thigh lifts for them, we do abdominoplasty or a complete body lift, and we also do chestplasty or thoracoplasties, whatever you may call it, for these patients. So these are the most commonly performed surgical procedures. Now, when it comes to non-surgical interventions, this is also becoming very popular. You have Botox, which is a very popular demand by our male patients. They would like to get their wrinkles on the forehead, crow's feet, and the bunny lines erased. Sometimes they even like to correct their laugh lines. And after this, it's the fillers, especially the aging male patient. They would like to get their tear troughs corrected. They would like to get their nasolabials corrected. Now, other important non-surgical procedure becoming very popular is the thread lift. So just like I told you that along with loss of weight, there's a lot of sagging of the skin. Also with aging, you can see a lot of sagging. So to erase this problem, we do what's called as a thread lift. So thread lift is again a very common requested procedure by males. And of course, there are a host of other technologies like radio frequency Morpheus, which we do for correcting the texture changes, for correcting the scars on the face, which we use routinely for our patients. Very popular requests, and a lot of males taking these surgeries.